In our last class, we discussed about the lumbar traction, right? So today's class, we will discuss about the application of cervical traction. So similar to the lumbar traction, here also the pathology or compression happened in the cervical area. So it leads to the condition called cervical radiculopathy. So in that condition, the patient will have pain in the cervical area, and that pain which will be referred to it is variating to till the arm level or till the forearm level or till the wrist or finger level with or without a sensory involvement. So with or without sensory involvement means patient will say like this: I am having a pain in the neck region and the pain is coming till my arm or coming till my forearm or coming till my fingers, and also I am feeling numbness in my fingers. So if the patient saying like numbness in the fingers means surely there is a involvement of sensory also. Okay. So in cervical radiculopathy there will be a pain in cervical region, followed by the pain relating to the arm region or forearm region with or without the sensory involvement. Okay. So if the patient complains, gave complaints to you like this means surely you have to think about there is something pathology happens in the cervical area. Okay. So that will be the cervical radiculopathy. So if the cervical disc is getting compressed or if the cervical disc which is compressing the nerve arising from the cervical area, so that the patient will say about the radiating pain like this. Okay. So for that, in exercise therapy, what available treatment option is traction. Okay. In exercise therapy, so not in complete physiotherapy, in our exercise therapy, so traction is the only option available for cervical radiculopathy patient. So in that cervical radiculopathy, we have to make the patient in a supine lying. Okay, we have to make the patient in a supine lying. Followed by, we need to apply the collar. So this collar, one end should be placed in the chin level, another end should be placed in the occipital level. Okay. So one end should be placed in the chin level, opposite end should be placed in the occipital level. The chin level, the collar placed in the chin level should not apply the compression in the tracheal area. So you have to be big precaution that tracheal area should not be involved in this end of the collar. Okay. So for preventing the breathing difficulties or preventing the breathing abnormalities. Okay, because trachea is always called as the windpipe. So if it is get compressed in the traction means the patient will feel restlessness. Okay, so the patient should be positioned in the supine lying, followed by we have to apply the collar, one end in the chin level, one end in the occipital level, and both these are hooked in the cervical pulley, which the cervical pulley is hooked in the S hook. Okay, movable rope. Okay. So then for lumbar traction, how much tension we mentioned? How much pulling tension should be mentioned in 3/10 of the patient body weight. So similarly for cervical region, we have to put the tension of 1/10 of the patient body weight, because for lumbar area there is a much larger muscular area. So the pulling force will not be enough if we apply for the 1/10 of the body weight. But in cervical region, the musculature is a small musculature only, so that we can go with the 1/10 of the patient body weight in order to avoid some other complications. Okay. So after that, same story. This is a power cable. After putting the switch, we have to go for the on-off switch. Then we have to select whether we need to apply continuous mode of traction or intermittent mode of traction. Then after that, we have to check for the option of where it is placed towards the lumbar or placed towards the cervical. So now we are applying for the cervical traction. So we are moving the knob to the cervical area. Then followed by we have to set for the tension. So what is your weight? 50 kg. So how much weight should you need to apply for the tension? Patient is 50 kg. So 1/10 of the body weight. So we have to apply a tension of 5. We have to set the tension of 5 kg. Okay. Then we have to set the timer. Then we have to set the timer. Then we have to start the treatment. So this one is the static cervical traction. In this application of the static cervical traction, so what all you have to see, what all you have to observe means the pulley should be in a straight level. If it is upright position means then the force of the vertebra will go in the upright way. So if it is placed in the same level or the straight level means only the vertebra is pulled in the straight way. Okay, so if it is pulling in a straight way means there is no need to worry about danger. So if it is pulling in upright way means then there is a high risk of spinal cord damage or nerve root damage. Yes or no? So for that we have to check whether it is in a straight level. Then we have to instruct to the patient. I will ask some question. You should not shake your head. You should not say the answer to your mouth. If for you okay means you have to thumbs up like this. If you are feeling discomfort means you have to reverse the thumbs up like this. Like that you have to give the instruction to the patient. Then you have to ask the question like, are you feeling the traction force? Is it comfortable for you? If you feel any discomfort means kindly let me know. Otherwise you can switch off this one. This is a safety switch where the modality will suddenly stop. Throughout the treatment session you should not close your eyes and you should not shake your head. Okay, so like that you have to give the instruction to the patient. So for avoiding the or abnormalities. Okay, so this one is the static traction. If we need to go for the intermittent traction, then we have to change the knob to the intermittent traction knob. In the intermittent traction knob, there is a two switches called hold time and then the rest time. So in that we can check for 40 seconds as a hold time and 5 seconds as a rest time. So in this mode, the traction force and the pulled length in the area will not be remain constant throughout the treatment session. Here there will be a contraction, elongation followed by a rest period. Elongation followed by a rest period. So like that it will occur. There is the intermittent traction. So in which condition we have to set for the static and in which condition we have to set for the intermittent? Any idea? If patient complains of acute pain or short duration pain, so for them we can go with the intermittent mode. If patient saying that they are having a pain for a longer period and also it's a severe pain and it's a chronic pain, so then we can go for the static. Is it clear? Do you feel comfortable? Is it no? Should not say that. So like that you have to apply the cervical traction. So is it clear? Do you have any doubt in this? Are you confident to handle the patient who came with cervical recovery to you in future? Okay? Thank you.